Bullying is a behavior that is repeated and intended to cause psychological, social, or physical harm. There are many different types of bullying, including social, physical, verbal, and cyberbullying. Bullying can be harmful to someone's mental health and self esteem and social relationships. People who bully often have low self esteem. In a 2019 study, one of every five students reported being bullied. In the same study, 41% of students who reported being bullied at school indicated they think that the bullying would happen again. Of those students who reported being bullied, 13% were made fun of, called names, or insulted. 13% were the subject of rumors. 5% were pushed, shoved, tripped, or spit on, and 5% were excluded from activities on purpose. Students who experience bullying are at an increased risk for depression, anxiety, sleep difficulties, lower academic achievement, and dropping out of school. Bullied students indicate that bullying has a negative effect on how they feel about themselves, their relationships with friends and family, their schoolwork, and physical health. A person involved in bullying may be more likely to develop mental health conditions such as depression and anxiety and develop suicidal ideations. Signs that indicate a child may be involved in bullying are loneliness, sadness, low self esteem, difficulty sleeping, changes in appetite, and loss of interest in social activities. Most reports showed children with disabilities, children who identify as LGBTQ, and minorities are more likely to be bullied than other children. The age group most affected by bullying is teens and tweens. Key people to prevent bullying are parents, educators, and the community. A person who's experiencing bullying and having suicidal ideation may display certain behaviors that can be warning signs for a caregiver to look out for. Some common warning signs include talking about death or wanting to die, feeling guilty or shameful, feeling like a burden to others, researching or making plans for death, showing an increase in alcohol or drug use, changing their eating or sleeping patterns, losing interest in personal hygiene and appearance. Suicide affects people of all ages. In 2021, suicide was among the top 9 leading cause of death for people ages 10 to 64. Suicide was the second leading cause of death for people ages 10 to 14 and 20 to 34. Suicide is a serious public health problem. Suicide rates increased approximately 36% between 2000 and 2021. Suicide was responsible for 48,183 deaths in 2021, which is about one death every 11 minutes. Ways to help prevent suicide include strengthening economic supports, creating protective environments, improving access and delivery of suicide care, promoting healthy connections, teaching coping and problem solving skills, identifying and supporting people at risk, lessening harms, and preventing future risk. There are many resources available to those having suicidal ideations, those experiencing bullying, and their caregivers, which are listed.